Hello and welcome to Radnor Studio 21, mainline public access television located in the heart of the Wayne Business District. This is True Stories, and I'm your host and proud Radnor resident, Megan Gummel. The purpose of this program is to provide stakeholders wanting to enrich the community and connect with residents a forum in which to speak their truth, share information, expertise, or advice through their personal stories. My guest today is Cabrini University's Nursing Program Founding Director, Jennifer Specht. She's a PhD and a registered nurse with extensive experience in administrative roles, most recently as the Dean and Director of Area Health School of Nursing. She has taught research, leadership, and critical care courses to undergraduate and graduate nursing students at DeSales University, Moravian College, and Widener University. She earned her doctorate at Villanova University and has served as a consultant for the Pennsylvania Department of Education. Jennifer is with us today to discuss the launch of a new Bachelor of Science in Nursing program beginning this fall at Cabrini University. Welcome, Jennifer.
Thank you. Hello.
I'm so happy to have you here.
Thank you for having me.
I'm sure I appreciate your time. You must be very busy getting ready to launch this exciting new program at Cabrini.
It is an exciting time at Cabrini.
And I'm looking forward to hearing more about it. But first, I'd like to rewind a little bit.
Okay.
And hear your story and your journey from nursing student to founding director of a nursing program.
Okay. Well, I'm from the Lehigh Valley, and I never wanted to be a nurse like my mother. My father was an architect. They both worked full-time, and she would go to work looking fresh, and he would go to work looking fresh, and she would come home not looking fresh, and he would come home still being in his pressed shirt. So obviously I was going to be an architect. And then when I was 13, he had a heart attack. And he was taken care of, and he was okay, but it was so impactful on me because when we were in the emergency room, I noticed that they not only saved him and took care of him, but they paid attention to my mom and to my brothers and to myself. So
treated the family as a whole.
Exactly. Almost. And they were just as concerned about us as they were about the patient, which was my father. So it was really one of those aha moments. And from there, I started to volunteer as a candy striper. And when with the outfits, yes. And I was, about 13, and then when I turned 16, I was able to sit and take the nursing assistant course. So I was able.
You didn't hesitate. You jumped right in.
I did.
This was your path, and no looking back.
No looking back. So I had. All in all, I've been in healthcare, if you include my candy striping days, for over 30 years. So I've had extensive experiences in all sorts of settings. Was thankful to have all of the mentoring as I was growing up in the healthcare system, in the hospital, from all the nurses. So I went to Villanova for my undergrad and practiced nursing, started in medical surgical like everyone did back in those days, and then went on to critical care. And at some point I realized that I was pretty much always wanting to talk about nursing, always wanting to share my knowledge, always wanting to tell my peers and our patients and their families all that I knew and help to educate them. And I became a resource on the units that I worked. And I would have nursing assistants who were starting out where I did that were very interested in becoming nursing students, and they would approach me and ask me questions. So I found myself sort of showing them like the ropes and,
mentoring.
Exactly. Before that was, the tag phrase. Yeah. So it was really, I realized that this was what I wanted to do. So I decided to go back to DeSales for my master's in nursing. They had a nurse educator track, so I was able to explore all the different nursing education pathways and ended up starting to take groups of clinical undergraduate students into the hospital and teach them. And at that point, I realized how much I loved it. I loved seeing the light bulbs go off over their heads.
So the education piece is where you started to focus.
Yeah, absolutely. I realized
instead of nursing, practicing as a nurse. You chose the education path.
Exactly. I still, as I was in school, I still practiced as a nurse, but I also enjoyed my time with the nursing students, teaching them how to learn their practice.
That transfer of enthusiasm.
Yes. So
Excellent.
I loved it, and I ended up, after graduating from DeSales, I ended up taking my first full-time faculty appointment there. And then I went on to pursue my PhD in nursing education, and I went to Villanova. They had a nurse education focus, and that has served me very well. So that's really how I ended up in academia, and I really enjoyed teaching all kinds of different students, traditional students out of high school, also students that are in second careers, students that are adult learners, graduate students. All of it was intriguing to me on different ways, and I enjoyed sharing my knowledge, particularly surrounding critical care, leadership, research. So it was
diversity. I wouldn't have imagined so much diversity, so that's excellent. You've had a hand in all that.
Yes.
So a lot of wines. So you landed at Cabrini.
I did.
And how long have you been there?
I've been there less than a year. It's been a wild year. We've done a lot of work. As you mentioned in the introduction, we have officially received, we're getting ready to launch the program because we have officially received approval from the Pennsylvania State Board of Nursing.
Congratulations.
And thank you. Very exciting. And our Middle States Commission on Higher Education accreditation is pending, and we expect that to be official very, very soon.
Be all ready to go.
Yes.
For the fall.
Absolutely. Well, we'll be accepting students next fall. So this fall will be this academic year really will be our recruiting period, and further program development, and then we're having students on campus next fall of 2020.
Okay. So tell me about Cabrini. How is this in alignment with Cabrini's mission?
So Cabrini was particularly attractive to me, not only because they advertised that they wanted to start a nursing program, and it was an opportunity to create a program from scratch. They had absolutely no nurse on campus outside of the campus nurse.
And having done a lot of teaching, had you ever created something of this magnitude?
Not of this magnitude, no. I mean, I've done curricular revisions in my previous administrative roles. I've done, helped to create master's curriculums and existing nursing programs that we're looking to expand. But to create from the ground up was an opportunity. It was a challenge, but it's also an opportunity of a lifetime in my eyes.
And you are clearly more than qualified and are making it happen. So Cabrini was founded in 1957 by the Missionary Sisters of the Sacred Heart of Jesus. So Cabrini is a Catholic institution. Is that something that attracted you to Cabrini?
Well, the Mother Cabrini, for which the university is named, she started the Missionary Sisters of the Sacred Heart of Jesus, and the focus that they started out with, or the foci that they started out with, was education, serving immigrants, and then healthcare. And they still maintain, they have a hospital in Australia, in Melbourne, Cabrini Health, and I had an opportunity to visit there. I was presenting some of my work at the Sigma Theta Tau International, that's the Honor Society for Nursing. I was presenting this time last year in Melbourne, and I had a chance to visit our sister healthcare agencies, and they have a lot of ideas, as do I, as does our president, Dr. Taylor, about how we can collaborate and put the mission forward, because Mother Cabrini, her mission was really to serve the population and the community that surrounds us, to engage with them, and to really provide an education of the heart, which is really a liberal arts education that is mixed with hands-on learning and the opportunity to really learn as you are learning in the classroom, you're also applying it out in the world, whether that's in healthcare or in the community.
Oh, that's beautiful and inspiring. And how do you stay in alignment with that mission? Are you in contact? Do you collaborate together? Is there a board that oversees that you're keeping in alignment with the original Mother Cabrini mission when you develop programs like this?
Well, when you develop programs within a university, certainly you're guided by their mission and their values. And I was extraordinarily fortunate because as soon as I started to research on Cabrini and what it meant to be a part of the Cabrini University community, I realized that it was an ideal match for nursing. Nursing is an art and a science. Cabrini is a liberal arts institution with Catholic social teaching. And it helps, it integrates, truly integrates nursing and the university's mission, and that it's really focused on social justice, which helps with the health equity focus of the curriculum. It's also focused on academic excellence, and for a professional program like nursing, that's important. And it's also focused on leadership development, and that's one of the key things to nursing education today, is allowing students, or not even allowing, to promote, to empower students to really feel like they are leaders. Nurses are the biggest part of the nursing workforce, and we have a voice, and we need to use it in terms of advocating for vulnerable and underserved populations, and to make sure that we are making change with not only within our practice settings, within our educational settings, and then our policy in terms of how healthcare is governed, because we are at the bedside, and we are beyond the bedside and beyond, and we know as a body, as nurses, what needs to happen. And the mission at Cabrini really supports that in terms of helping the students to really engage. That education of the heart is an engagement with the community and applying what they're learning directly to the community that we serve, whether that's our local community like Radnor, the greater Philadelphia, like the United States, or globally. Yes.
Exactly. I love that. Art and science. It's a wonderful way of looking at it. So how are you preparing for, you're expecting hopefully more enrollment of more students at Cabrini. You have the next year to prepare for that?
We do. So we have had a lot of interest. We have an extraordinarily strong science department at Cabrini, and recently we have divided into schools. So the university is divided into 4 schools, one of which is the School of Natural Science and Allied Health, and that's where nursing will be housed. And science, of course, is a huge part of our nursing curriculum. Science, math, the liberal arts, and then, of course, the nursing specific courses. So capitalizing essentially on our strong science department, knowing that we have had students that have come in the past that really wanted to be nurses and came as biology majors or science majors and then had to transfer out to pursue nursing. We are so happy to be able to capture them. We have a fair amount of student athletes that come. We have a really good...
You do? I was going to mention that, but I will segue
Very proud.
Congratulations to both the men's and women's lacrosse teams, as well as the men's tennis and golf teams.
Yes, thank you.
I did not know about Cabrini.
Yes, we are powerhouses athletically. Yes. And that's a new conference as well. So
yes, it is. So that's another draw.
Absolutely.
To Cabrini.
Absolutely. So to be able to say that we do now offer nursing is really exciting. The coaches and the athletic directors, they are thrilled that we can offer it officially. And there's a lot of other, the allied health aspect. We have degrees in health science, exercise science, public health, social work. So there's a lot of other degrees that part of the thread of the curriculum that I created is interdisciplinary. So I'm working with, or will be working with, the chairs of those departments to integrate all of the different the majors, which ultimately will be disciplines when we get out into the workforce, so that they can learn how to work together. And in addition to doing that internally at Cabrini, I have started to forge partnerships with health systems as well as community partners, so that we can create interdisciplinary experiences for our nursing students, along with medical students or respiratory therapy students or physical therapy students, so that once
little specialties that you can go into, and that's great, because how does the timing was just right for this with Cabrini, and if you could elaborate on, there's an increase in demand for nurses, and then there's so many different specialties, because I think we think of nurses, or I do, as my experience in the hospital when I had my children, or just going to the doctor's office. There are so many would you say specialties? Is that?
Well, specialties or pathways or areas that you can function. I mean, a registered nurse can function in an insurance agency. They can work in government.
Career options must be vast beyond,
yes,
I'm sure, what I even understand them to be.
Yes. Well, it's typically when we think of nursing, we do think of when I had my baby, when I go to the doctor. So like that acute care, that primary care. What the curriculum being that we are moving in healthcare towards not solely focused on acute care, but into the community and really a focus on population health. Our curriculum was built with that in mind because it is forward thinking and innovative. So we are going to give students experiences not only in acute care, because that's super important, but also in our community settings or in places where they can function in terms of their career options. To answer your original question about the demand for nurses, even though it seems like we have a lot of nurses, the workforce of nurses in the United States, over half of them are age 50 or older. Oh. So they are expected, the retirement age, about 1 million registered nurses will reach retirement age within the next 10 to 15 years. So we already have a nursing shortage in terms of just here and now, but add on the baby boomers that are aging, there'll be more demand for care because they will need care. And then the baby boomers are also retiring from nursing. So the pipeline needs to be filled, and the U.S. Bureau of Labor Statistics, and they did a survey, a projection really from 2016 to 2026, and they're saying that we are going to need an additional 15%, which is roughly just under 500,000 nurses by 2026.
And those baby boomers are going to need someone to take care of them. Because I'm from non-medical senior care, and that's a whole other specialty that you can go in, is caring.
Exactly. Geriatrics or elder care, absolutely. There's 1 million, when you have a nursing degree, the world is your oyster because you really can go in to anything. Data management, I had a student that went on to create or to work with people that had created electronic health records. And she started out, in a nursing program that I taught, and she went in a completely different direction than what the traditional direction is, but she was still using her nursing degree to help.
Do you have to know what you want to specialize in when you enroll as a student?
No, you don't. In fact,
What's the first step? I know I'm interested. Nursing, I have the passion for it, the science and the arts, I love that coming together. What is a first year when somebody goes in? When do you have to know the specific track you're going down?
So as an undergraduate student, you don't have to have a specific track. You can just know that you want to be a nurse. And some students come in and say, I absolutely know exactly what kind of nurse I want to be. Some of them truly graduate and become that exact nurse. A majority of students, in my experience, then I'm going to use obstetrics, having babies as an example. Nothing against that, just as an example. A lot of people come in and say, I want to be a mommy baby nurse. Then they get to their obstetrics course, they experience it in real time, and they say, no, that's not what I want. But you know what I really liked? I liked pediatric oncology, which is taking care of kids with cancer. It's a complete switch, not unheard of. I mean, college students in general as undergrads change their mind a lot. There's a lot of ambiguity in terms of what they want.
The students are exposed to all the options. So again, they might go in thinking one thing, but their exposure will have them connect with something else.
Yes, that's part of our job when we create a nursing curriculum, is that we include all the specialties. So mental health, pediatrics, obstetrics, critical care, medical surgical, all of the different options. And then there are threads built into that, which is specific to each school. So the threads that I have decided were in alignment with both Cabrini's mission, my personal thoughts on what it should be in a nursing curriculum, and then answering the call of all of the various professional organizations, whether it be in nursing or in healthcare. And I have included the care of populations, population health, the interdisciplinary care that I've talked about, as well as the care of vulnerable and underserved populations, which includes not only socioeconomic or race or ethnicity, but also the LGBTQ community in terms of their healthcare needs moving forward and the disparities that all of the underserved populations experience. That's very much
an excellent point. that community, the LGBTQ, that must be something that's now on everyone's radar. There were probably people who specialized in that. That must be growing.
The need for
that.
The need for nursing students and all healthcare professionals really to have a better understanding of that community's needs and what this, particularly their healthcare needs. And I have a course built into our curriculum that specifically addresses essentially from adolescence or childhood through aged care of the LGBTQ population, simply because it's problematic. We have a lot of suicides that occur in our LGBTQ youth. So addressing those issues.
Depression overall seems to be affecting everybody.
Right. And all the way through aged care, can two partners that have lived together their whole lives, now when they go to aged care,
they can't
age together in some situations. So there's a lot of research and a lot of foci.
That's another...
There's many things that need to be focused on. So the curriculum is really built from my experience and all of the call of our agencies. The American Association of Colleges of Nursing puts out what they call the essentials of nursing education at the baccalaureate level, and they tell you what you should be thinking about when you create a curriculum, excuse me. And then there's the National League for Nursing, the Institute of Medicine, which is now called the National Academy of Medicine. They put out the Future of Nursing 2020 with their vision as to what should happen for nursing in both practice and in education. And now they are working on their vision for 2030, since 2020 is next year. And included in that is revisions to nursing education that is inclusive of all the things that we've talked about today, and making sure that we're paying attention to
it sounds like an incredible and a robust program. You want to talk about enrollment process? What would you like to speak about? Anything we didn't touch upon that you would like to speak about?
Well, I'm excited to announce that as of August 1st, that students can apply through the Common App. And if they're in a hurry to apply before that and they want to apply to specifically to Cabrini, they can use the application on our website. And we are going to host some open houses in the fall and the spring, and I will be at them. I'm happy to answer any questions anybody might have. It's a new program. I'm excited to talk about it and excited to share what we've created. It
sounds fabulous.
Thank you.
Thank you so much. You're doing an excellent job in the short amount of time. And again, thank you for your time for coming in today. Yep. I look forward to hearing more about it at Cabrini University.
Great. Thanks for having me.
For more information about Cabrini University and the Bachelor of Science in Nursing program and all the other programs they have to offer, please visit cabrini.edu. I want to thank my guest, Jennifer Specht, for joining me today, the entire staff here at Radnor Studio 21 for making this program possible, and to you, the viewer, for watching True Stories. I'm Megan Gummel.